What if stopping a neurologic medication doesn't just remove its benefit, but actually creates a completely new set of symptoms that can confuse both you and your patient? This practice test question we're going to cover focuses on that. Hey guys, welcome to This Is Why, a show where we help healthcare professionals transform their medical knowledge from what to why, because that improves the how and even how you answer questions on exams. Okay? I'm Dr. Busti, and today we're going to be working through a high-yield clinical scenario involving medication discontinuation and what can happen when the brain has adapted to ongoing pharmacologic therapy. Okay, so here's the case. We have a patient with Parkinson's disease experiencing intolerable adverse effects on therapy, okay, of ropinirole for 3 months. Okay? Which statement regarding the discontinuation of ropinirole is true? Okay? A, taper is not required for this drug. B, tapering is recommended but not necessary. C, tapering is necessary if therapy has continued over 6 months. D, tapering is required to reduce the risk of withdrawal. All right, guys. Now, this question, if we think about the type of knowledge that's being assessed, let's stop, because remember the goal of answering these questions is to learn how to answer the question, to understand what is being asked. So this question is testing pharmacology with a focus on medication discontinuation safety and adverse effect management, specifically for dopamine agonist withdrawal. Okay? Now when we follow that Bloom's taxonomy level, this is about application. Ropinirole is a dopamine agonist, most commonly used for Parkinson's disease. It does come in an immediate release or extended release formulation, but also restless leg syndrome, most commonly used in an immediate release dosage formulation. Now you need to apply your understanding of drug mechanisms and the clinical consequences to a real patient scenario. So our approach here in test-taking skills is to understand what the question is. What happens when you stop a dopamine agonist? And also, does the indication, in this case, or dose, duration, matter? Okay? When you see a drug that acts on the central nervous system, especially one that mimics neurotransmitters like dopamine, you should immediately think about physiologic adaptation. Remember, the brain is going to adjust with chronic stimulation, so any abrupt removal can create a withdrawal state. That should push you towards answers involving tapering. Okay? Now that is true of most medicines that work in the central nervous system because of the influence on the biology. Now consider some of the confounders and modifiers. What is the big trap here? Duration. 3 months of therapy was said, right? The question tells you that. But the available evidence does not support that a duration is specific to the withdrawal and is relevant in this scenario. So if you find yourself anchoring on time or duration, you're being led by and led into a distractor in this case. What about the indication ropinirole? I mean, it's being used for Parkinson's disease. Yes, it occurs in both the evidence for restless leg syndrome and Parkinson's, but the evidence and its strength is greatest in the Parkinson's literature, but it's still there. Okay? So the distractor words of watching phrases like not required, we saw that, recommended but not necessary, and only if, the strong words tend to be things that are guiding you away typically, if you had to guess, you're getting away from the wrong answers there and moving towards the right answer, okay? These minimize the risk or introduce arbitrary thresholds, which are classic board exam, basically traps, when the correct concept is more absolute. So the correct answer here is D. Tapering is required to reduce the risk of withdrawal. Now, why does that happen? Remember, dopamine agonists like ropinirole stimulate dopamine receptors specifically and more particularly D2 and D3, and over time that brain biologically adapts to that stimulation. And when the drug is removed, especially abruptly, patients can develop that dopamine agonist withdrawal syndrome, DAWS. Okay? Now think about it this way. The brain is suddenly in a relative dopamine deficient state. So it's not just from the disease itself, but from the loss of pharmacologic stimulation it has biologically adapted to. And so tapering helps gradually reduce the receptor stimulation and allows the brain to adjust, which reduces the severity of withdrawal symptoms, although it does not completely eliminate the risk. So option A is incorrect because the taper is absolutely required due to the risk of withdrawal. Option B is incorrect because while tapering may sound optional, in this context it is a necessary safety step. And option C, or the third one, is incorrect because it introduces a false time threshold. Okay? Again, withdrawal can happen even with shorter durations of therapy. That's what the evidence shows. So tying tapering to a 6-month cutoff is not clinically accurate in this topic. Okay? So one of the core teaching points that you need to get walking out of this question is the real issue is that dopamine agonist withdrawal is a physiologic phenomenon, not just a theoretical concern. And why does it matter for you and the patient? The patient can start now developing symptoms such as anxiety, agitation, depression, panic attacks, fatigue, orthostatic hypotension, nausea, vomiting, diaphoresis, and even drug cravings. And these symptoms can be severe, they can be distressing, they can easily be misattributed to another psychiatric disease going on, or even the progression of Parkinson's disease. So tapering reduces the risk, but here's the key insight. It does not guarantee prevention. Even with a slow taper, some patients will experience withdrawal. Okay? Now on exams, when you see that centrally acting medication, especially those involving dopamine, serotonin, GABA, right? Always think about withdrawal risk. That's consistent. Avoid answers that minimize tapering unless you're absolutely certain the drug does not require it. Okay? Also be cautious of answer choices that introduce arbitrary timelines unless you know of a specific duration-based rule that does exist. Now, if you found this question to be helpful on exactly the way to approach a question, and you want to do more of these, this is how we teach and approach our questions in our QBank at High Yield Med Reviews that I started. And we developed those board-style questions and help you practice learning how to break them down and understand why the right answer is the right answer and what is the core concept being tested, because no one has the full questions to an exam. So if you understand the concept, you can apply it to any question given to you, right? We don't want to just memorize facts. We want to understand how to apply those concepts to questions. Okay, guys, I'm Dr. Busti, and thank you so much for joining us. I hope you found this to be helpful, and we'll see you next time. Take care.